How does lung cancer spread through anatomy? Imagine your lungs as a pair of spongy, air-filled organs that help you breathe. When lung cancer develops, it starts in the lung tissue itself, often in the cells lining the airways. From there, it can grow into nearby healthy lung areas, a process called local invasion. This means the cancer can extend into the lining of the lungs, known as the pleura, or into adjacent lobes of the lung. This direct extension is one way the cancer spreads within the lung itself. Beyond growing locally, lung cancer can also spread through the lymphatic system. The lymphatic vessels are part of your immune system and run throughout the lungs and chest. Cancer cells can enter these vessels and travel to nearby lymph nodes, especially those in the mediastinum, which is the central part of the chest, or in the hilar region near the lung's roots. This lymphatic spread is common in lung cancer and often occurs before the cancer spreads to distant parts of the body. Another pathway for lung cancer to spread is through the blood vessels. Cancer cells can invade the blood vessels within the lung tissue, allowing them to enter the bloodstream. Once circulating in the blood, these tumor cells, called circulating tumor cells, can travel to distant organs such as the brain, bones, adrenal glands, and liver. For successful metastasis, these cells must survive the mechanical forces of blood flow and stick to the walls of blood vessels at new sites. For lung cancer cells to establish new tumors elsewhere, they undergo changes at the cellular level. One key change is called epithelial-to-mesenchymal transition, or EMT. During EMT, cancer cells lose their adhesion molecules, like E-cadherin, which normally keep cells stuck together. They gain proteins such as vimentin and alpha-actin that help them move more freely. This increased mobility makes it easier for cancer cells to invade tissues and spread. Once cancer cells reach a new site, they exit the blood or lymph vessels, a process called extravasation. After leaving the vessels, they interact with the local environment, including immune cells and other supportive cells, to establish new tumor colonies. In bones, for example, lung cancer cells can interact with bone cells like osteoclasts and bone marrow macrophages. They may also use nearby fat cells as an energy source, which helps them survive and grow in the bone tissue. In summary, lung cancer spreads through a combination of growing into nearby tissues, invading lymphatic and blood vessels, traveling through these systems, and establishing new tumors in distant organs. This complex process involves physical movement through the body's anatomy and molecular changes that enhance the cancer cell's ability to survive and invade. Understanding these pathways is vital for diagnosing, staging, and planning effective treatments for lung cancer. Always remember, early detection and medical guidance are key to managing this disease and maintaining lung health. If you have concerns or risk factors, consult with healthcare professionals for personalized advice.